Welcome to Nursing Simplified, the smart way to survive nursing school. In today's episode, we are going to talk about my secret trick that you can use to answer prioritization questions on any exam quickly, easily, and correctly every single time. So let's dive in. So, how do we spot priority questions? Well, priority questions use certain keywords in the stem of the question. And once you learn to recognize these keywords, you can apply this method to systematically choose the correct answer every time. You might see words like first, best, important, most, initial, priority, ambulance, emergency, return to or arrive to the floor. And here's the great news. These keywords will be bolded on the NCLEX. Let's look at some of these words and phrases in context, or how you might see them on an exam. First, which patient should the nurse see first? Best, what is the best course of action? Important, what is the most important assessment? Most, which finding is most critical? Initial, what is the nurse's initial response? Priority, what is the priority nursing intervention? Ambulance, a patient arrives by ambulance. Emergency, a patient arrives in the emergency room. Return to the floor, a patient returns to the floor after a procedure. So, any variation or combination of these words is a clue that the question is assessing your ability to prioritize as a nurse. Now that we have identified that a question is a priority style question, what is the secret trick that we're going to use to answer it correctly? Well, it has to do with our good friend Maslow and his hierarchy of needs. Let's do a quick refresher on Maslow's hierarchy of needs. We all start with a set of necessary, basic physiological needs for things like air, food, water, warmth, and rest. We then have an urgent need for safety and security, like protection from the elements or protection from attack. As long as those needs are met, we can move into the spiritual and psychological needs that we all have, which are needs for friends, love, respect, and happiness. But remember, a pyramid can't stand without a base. So our needs must be met from the base of the pyramid before we can move upward. For example, we don't need shelter if we have no air or can't breathe, and we don't need love if we don't have our basic security needs met. Now, Maslow's hierarchy has 5 sections, but we're going to make it a little bit easier and condense it into 3: physiological, safety, and psych. Then off to the side, we're going to keep pain just in the back of our minds, and we'll talk more about that in a minute. Let's start at the base with physiological needs. We are going to use an A, B, C, D organizational mnemonic in that order: airway, breathing, circulation, decreased level of consciousness. And remember, when we go through these, it will be in that order: A, B, C, D. Let's talk about the airway. Is the patient's airway open? Can air move through the airway? The question is, can air get from outside the body into the lungs? Next is breathing. Is the patient short of breath? Are they breathing effectively? Is their oxygen saturation low? Do they need supplemental oxygen? And the question here is, once the patient gets the air into the lungs, can the body get the oxygen it needs and get rid of the carbon dioxide it doesn't need? Breathing is not only about what happens when the patient takes a breath, but it's also about what happens with the air once it gets into the lungs. Circulation. Are they bleeding or hemorrhaging? How is the patient's blood pressure and heart rate? And then we have decreased level of consciousness. Is there a head injury? Are they confused or disoriented? These are the kinds of questions we have to ask. Now that we have covered the physiologic needs, let's move up the pyramid to the next section, which is safety. And when we're talking about safety, we're talking about protecting our patient. Protecting the patient from any safety risks that present themselves. For example, making sure the patient doesn't fall, giving them their call light and putting the bed in the lowest position, ensuring all of their IVs and tubes are secured and not all jumbled up, making sure they're safe during a procedure or after being given a medication, things like that. Now we can move up to the top of the pyramid, to the psychological section. We ask ourselves, is our patient anxious, afraid, depressed? The big difference here is asking the question regarding suicidality or homicidality. If the patient is suicidal or homicidal, this would bump them up to the safety category, as we need to protect them from themselves or protect others from them. As promised, we're going to talk about pain. And we keep this one off to the side a bit because pain is not black or white. It depends on the reason for the pain. If a patient has postoperative pain, then that would be expected. What we need to ask ourselves is if the pain is related to loss of limb or loss of life. For example, is the patient having chest pain from a heart attack? That would make it a higher priority. So as a quick review, we are going to use Maslow to answer priority questions. Go through the answers systematically, A, B, C, D in that order, then safety, then psych, and then check in with pain to decide if it needs to be a priority. Let's go through some questions and see how we do using this method. In our first question, the nurse plans care for a client in the post-anesthesia care unit. Which of the following should the nurse assess first? A, respiratory status, B, level of consciousness, C, level of pain, D, reflexes and movement of extremities. If you would like to pause the video for a moment to try to work through this on your own, go ahead and restart when you think you have the answer. Let's look at option A, respiratory status. This is a physiologic one, so right away we know this will trump any safety or psych answers. And since it's the only answer we have to work with right now, we're going to mark this as our priority. Option B is level of consciousness. This is also physiologic, but remember, we prioritize them in the order of A, B, C, D. Airway, breathing, circulation, decreased level of consciousness. So respiratory clearly trumps level of consciousness. Our priority remains the same. In option C, we have level of pain. The question told us that this patient is in the post-anesthesia unit, which means the patient just had surgery or a procedure, so pain would be expected. So as of right now, we still have respiratory status as our number one choice. Lastly, we have reflexes and movement of extremities in option D. This would fall under safety. Remember, we talked about safety during or after procedures, and here we would be checking to see if the patient is not suffering any neurologic issues from the procedure or anesthesia. Therefore, respiratory status still remains our priority. So after going through our process, the correct option is A. Respiratory status. This patient had some sort of a procedure, and general anesthesia and mechanical ventilation can impair respiratory function and oxygenation in the post-anesthesia period. Let's move on to our next question. The nurse is caring for an immediate postoperative patient. Which of the following is a priority action? A. Educate the patient on the availability of pain medications. B. Assist the client when getting out of bed. C. Change the client's dressing. D. Begin discussing discharge planning. If you would like to try this one on your own, go ahead and pause the video for a moment and see how you do. Let's go through these one by one. Option A, educate the patient on the available pain medications. This has to do with pain and teaching. Now remember, this patient just came out of surgery. They're likely very tired and probably sleeping most of the time. Also, it's about pain. And nothing in this indicates that this pain is related to loss of limb or loss of life. It is more than likely typical postoperative pain, which is expected. So we'll mark this as our priority because it's the only option we have right now. But I have a feeling something else will take priority. Option B, assist client when getting out of bed. Well, this isn't a physiological need, but it is a safety issue as we want to prevent falls. So this would fall under safety. And since safety trumps pain that is not related to loss of limb or loss of life, we will mark this as our priority. Option C is to change the client's dressing. This would fall under safety as we want to prevent infection. So now what happens? We have two safety options. What we'll do is we will mark this additionally as a priority, and then we will whittle it down a bit later. Option D, begin discussing discharge planning. Well, why do we talk about discharge planning? Discharge planning helps to prepare the patient for discharge and will make sure he's safe when he leaves the hospital. So we have yet another safety option. We'll go ahead and mark this, and then we will work to eliminate two of these answers. So we decided there were no pressing physiological needs, and safety comes next. We have three safety options: option B, option C, and option D. So how do we decide between the three? Let's take a look. Option B is helping the patient out of bed so he doesn't get injured. We're going to do this now because we don't want to prevent a fall. Option C is to change the client's dressing. Now, don't read into this answer. Sure, we will eventually change the dressing to assess the incision line and clean it to prevent infection, but not right now. So, because this is something we're going to do later and not in the here and now, it's safe to say that this is not going to be our priority, and we can eliminate this one. Option D is similar because we're talking about the patient's future safety, not something that we're going to do in the here and now. Therefore, we can eliminate this one as well. So by process of elimination, we can confidently say that B is our correct answer. Assist the client when getting out of bed to prevent falls in the here and now. Let's move on to our next scenario. After a change of shift, you are assigned to care for the following patients. Which patient should you assess first? A 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to the lab. B, A 55-year-old with COPD and a pulse oximetry reading from the previous shift of 90% saturation. C, a 70-year-old with pneumonia who needs to be started on IV antibiotics. D, a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. And again, if you would like to, go ahead and pause the video for a moment and try to work through this one. Okay, let's start looking at our options. These are starting to get a bit more complex. Option A, a 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to the lab. I would categorize this under safety. We want to get a sputum specimen to see what's going on and if there is an infection or anything else brewing there. Don't let the fact that the patient is on a ventilator throw you. Nothing indicates that the patient is not stable on the ventilator. So we want to get this done in a timely manner, but there isn't anything pressing here, so I have a feeling this won't be our priority. But we'll go ahead and mark it as it's our only option, and let's keep going to see what else we have. Option B, a 55-year-old with COPD and a pulse oximetry reading from the previous shift of 90% saturation. This looks physiological, so let's start our ABCDs. Is this an airway issue? No, nothing tells us that we have an unstable airway. Remember, airway has to do with the actual airways. Can air get from outside the body into the lungs? In this case, nothing indicates that's an issue, so we move on to breathing. And remember that breathing is about what happens to the air that the patient has already gotten into their lungs. Can the body get the oxygen it needs and get rid of the carbon dioxide it doesn't need? Since we're talking about oxygen saturation, this would fall under breathing. The body is using the oxygen it took into the lungs with about 90% efficiency. So we can agree that this falls under B, breathing. Therefore, B becomes our priority. Let's take a look at option C, a 70-year-old with pneumonia who needs to be started on intravenous or IV antibiotics. This is another one that's going to fall under safety. Typically, we want to get antibiotics started within an hour of ordering them after we get any necessary cultures that we need. So, thus far, option B will remain our priority. Option D, a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. Okay, this is definitely physiologic. So let's go through our ABCDs. First, we ask ourselves if this is about the patient's airway. The question is telling us that this patient has asthma and has used a bronchodilator, which was not effective. This means the airways are still constricted or tight, and this can affect the patient's ability to get air into the lungs. But because it's a physiologic issue and we want to double check, we're going to just additionally mark this one as a priority. So let's take a look at the two physiologic options, option B and option D. And remember, we always make our choice between the physiological priority by going through the A, B, C, Ds in order, with A taking the highest priority. We decided that option B was about breathing and option D is about airway. Airway trumps breathing every day of the week. Therefore, our correct choice here is D, the 50-year-old with asthma who complains of shortness of breath after using the bronchodilator. This is the patient we would see first. Time for our last scenario. When assessing a 22-year-old patient who required emergency surgery and multiple transfusions 3 days ago, you find that the patient looks anxious and has labored respirations at the rate of 38 breaths per minute. The oxygen saturation is 90% with the oxygen delivery at 6 liters per minute via nasal cannula. Which action is most appropriate? A. Increase the flow rate on the oxygen to 10 liters per minute and reassess the patient after about 10 minutes. B. Assist the patient in using the incentive spirometer and splint his chest with a pillow while he coughs. C. Administer the ordered morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation. D. Switch the patient to a non-rebreather mask at 100% oxygen and call the physician to discuss the patient's status. Go ahead and pause the video and see how you do working through these options. Okay, so there's a lot to unpack in this question. There's quite a bit of information, and we could discuss all of the signs and symptoms in this scenario. But let's just see if we can prioritize the answers using our method. Starting with option A, increase the flow rate on the oxygen to 10 liters per minute and reassess the patient after about 10 minutes. So, this is a physiologic option, and it has to do with breathing. It's our only option right now, so we'll go ahead and mark it as a priority and then see if any of the other options would take priority over this one. Option B, assist the patient in using the incentive spirometer and splint his chest with a pillow while he coughs. Well, we teach the patient to splint and cough and use the incentive spirometer to prevent pneumonia after a procedure. So this answer has to do with the patient's safety, preventing an unwanted outcome. So as of right now, that leaves option A as our priority. Option C, administer the ordered morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation. This answer is suggesting that the patient is breathing very rapidly due to anxiety, and that if we just give him some morphine for his anxiety, he will stop. So this actually falls under psych, which leaves option A as our priority. Option D, switch the patient to a non-rebreather mask at 100% oxygen and call the physician to discuss the patient's status. So if we just look at what we have here, we can tell that this answer is about breathing. So we're going to go ahead and mark this, but that leaves us with the need to make a decision between our two answers about breathing. Okay, so let's decide which of these two is our correct answer. First, we have option A, turning up the oxygen on the nasal cannula and checking on the patient's status in 10 minutes. Option D, we're placing him on a non-rebreather, which is a method of delivering high levels of oxygen and calling the physician to discuss the patient's status. When we're trying to decide which answer to choose, we want to look at which answer has the higher priority response. With option A, we're turning up the oxygen and then walking out of the room, and then we'll check on him in about 10 minutes. In option D, we're giving him high levels of oxygen and calling the physician to determine what to do next. Option D is the more aggressive choice, as we are taking immediate and significant action. We are not even leaving the patient's bedside, as we're likely calling the physician from the room. So, because option D treats the patient more aggressively and with immediacy, this is considered the priority option, and it is our correct choice. And now for a quick recap. Look for the keywords that will give you a hint that this is a priority question. And remember, on the NCLEX, they will be bolded. Once you have determined that you are looking at a priority question, use the simplified Maslow approach, breaking the triangle down into just 3 segments: physiological, safety, and psychological. When you're looking at the physiologic needs to prioritize answer items, use A, B, C, D in order. That is, airway, breathing, circulation, and decreased mental status. When you come across a pain item, remember that it only trumps the other sections if it is related to loss of limb or loss of life. And lastly, when you wind up with multiple options in the same category, prioritize between them using the exact same steps. And there you have it. Today we talked about the systematic way to answer priority questions correctly every time. In our next video, we will be reviewing the secret method you can use to master select all that apply test questions. But for now, congratulations. You are a master at answering priority questions. And remember, you are beautiful, you are needed, you are loved, you are strong, and most of all, dear friends, you are enough. And if you liked this video or you learned something, hit that like button and subscribe to our channel because you don't want to miss what's coming next. Now get out there and be the amazing nurse that you were meant to be. And remember, nursing is a work of heart. See you in the next video. Bye-bye.